welcome to this, the fourth National Autism Awareness Day function being run by Telethon Kids Institute and supported by the Rotary Club of Scarborough. My name is Jim Joseph and I'm a member of the Rotary Club of Scarborough and a grandfather to grandsons living with autism. So I have a bit of an inside running, I guess, on what happens in an autistic family. I'm here for the same reasons that we're all here, and that is really to learn a little bit more about autism, this autism spectrum disorder. Because there's a lot of people here who won't know one another, that is the attendees, what I'd like you to do is to just look to your left, look to your right, and introduce yourself to those people alongside of you, so that it's not a whole team of individuals here. We know one another, we've had a bit of a laugh as we shake hands and so on. In the first year, the theme was making a difference, and specialists from Curtin University and Princess Margaret Hospital came down here and they spoke about autism and finding a place in society. And those of you who might have been there will remember that as a particularly successful day, because it allowed the people, the families living with autism, to interact directly with some of the specialists. The second year, 2015, the theme was Planning for a Happy Life, and we had a number of speakers who spoke about this theme under the topics of education, mentoring and employment as some of the key issues. Last year we had the theme Listening to the Autistic Voice, and we had two wonderful speakers who spoke very personally, if you were here and you recall this, who spoke very personally on that subject. And as well, Professor Andrew Whitehouse spoke about how can we continue to move the WA autism community forward. This year, 2017, has its theme Working Together to Fulfil Potential. And we have four wonderful speakers who will talk on that theme, and the format will be very similar to what we had on the very first year. As well, Andrew is going to conduct a panel discussion after the guest speakers are finished. And to complement today's agenda, there are many service providers and programs and research studies that are on show down there. And I'd like to just mention some of them, and I would strongly suggest that if you get the chance during morning tea or after the program is over, please just go through and have a look there, because they cover a wide range of areas supporting families living with autism. So the Ability Centre, the Occupational Therapy for Children, Autism and Education Services, Autism Association of WA, Autism CRC, Autism West, Behaviour Analytics Special Education Services, Child Wellbeing Centre, Curtin Autism Research, Consumer and Community Health Research, Direction Psychology, Disability Services Commission, Interlife, Interventional Services for Autism, Kids Are Kids, Next Challenge, Noah's Ark and Independent Living Centre, Rocky Bay, Smart Talk, Speech Pathology, Sonic Learning, Telethon Kids Institute, Therapy, Learning and Communication, and WA Centre for Autism. There's some fabulous stuff there, and I looked at it as I walked around there this morning, looked at it through not my eyes as a person thinking, isn't that interesting, but looked at it through the eyes of a grandfather, a person living with autism in our family. So I strongly recommend that you have a look through that, and I'm hoping that you'll get a lot out of it. There's no doubt, is there, I think, that this whole subject of ASD is getting much, much more publicity than ever before. And events such as this National Autism Awareness Centre, where medical specialists and those living with autism can come together in a common place to listen and learn, are becoming increasingly vital in understanding more about ASD. So where does Rotary fit into all of this? I'd like to just touch on that a little bit. But before I do that, I'd like to welcome our incoming District Governor, Lindsay Dry, sitting down here. Lindsay will be District Governor, and that's the top position for a Rotarian in our particular district. And this particular district that we belong to as Rotary Club of Scarborough is enormous. So Lindsay has a massive amount of work to cover, and he's got a big geographical area to cover as well. Could I also, wherever Jerry Pilcher is, welcome back past District Governor Jerry Pilcher. He's around somewhere, I know. He's attended each of the past 3 functions and is a great advocate for the work that we're doing. So to Lindsay and Jerry, thank you very much from that top level of Rotary in Western Australia. Can I also say at this point that our Rotary Club of Scarborough is very keen to continue our association with Andrew Whitehouse and his team at Telethon Kids Institute, and we, as Rotary in general, we want to play a bigger part in growing that awareness of autism in the community. And in fact, in that regard, earlier this year, our club contributed financially towards the WA Autism Register. Andrew, I've got that right, I know. A world-renowned piece of infrastructure set up by Andrew at Telethon Kids Institute in WA. This WA Autism Register, just for your interest, is well known throughout the whole of the world. It's proving invaluable for those clinicians who use it. It's a very powerful research tool, and maybe Andrew will touch on that a little bit, for both understanding the prevalence and the pattern of diagnoses throughout time. Excuse me just a minute. As I would have mentioned last year, Rotary is a worldwide organisation, approximately 1.2 million men and women who are dedicated to helping people in need. The main objective of Rotary is service. That's service in the community, it's service in the workplace, and it's service throughout the whole world. And this type of day that we're looking at here is our contribution to working within the community. So Rotarians develop various community service projects that address many of today's most critical issues, such as children at risk, poverty and hunger, the environment, literacy and violence. There are many, many projects that Rotary gets involved in on a local, national, international scene. Some of these include Polio Plus, and you may well have heard about that, where Rotarians around the world have raised well over $1 billion to try to eradicate polio from the face of the earth. And we're doing that in conjunction with World Health Organisation. So that's a lot of money when you think about it. Money that has to be raised from the public by virtue of the various projects that the club see. Food Bank is another one where Rotary is heavily involved. Bowel scan, prostate cancer awareness, Australian Rotary Health, the Rotary WA Cord Blood Bank Centennial Project, Shelter Box, and there's many, many more. And of course, our Rotary Club of Scarborough's Wheelchair for Kids projects, which you would have all passed as you came in. And I know I've spoken about this before, but that project is just providing massive benefit to disadvantaged young kids around the world, particularly in war-torn countries. And this year, the number of wheelchairs that has been manufactured from start to where we are now is 36,378 wheelchairs, which is a huge number of wheelchairs produced by people who are volunteering their time, their skills, their effort. Could I now come to introducing Professor Andrew Whitehouse, and many of you will know him. His passion, his life's work has been dedicated in helping those people with living with ASD. He's the Winthrop Professor of Child Development at the University of WA. He's the head of Developmental Disorders Research Group at the Telethon Kids Institute. He's a well-known science communicator. He regularly speaks on scientific and ASD matters for both national television and radio. He regularly writes a column for the West, and he's published many books. And you look at him and you think, hang on, this guy's only 30 odd. How could he have done all of that? But I suspect he's probably a bit older than 30 odd. His research has been profiled in New York Times, Time Magazine, BBC, CNN, and The Economist. Ladies and gentlemen, would you please make welcome Professor Andrew Whitehouse, whose passion has led to today.
Thanks very much. Yes, let's just go for 30-something. How about that? Thank you very much, Jim. That was truly awful to listen to. The first bit was wonderful. So thank you. Look, we started, wow, look at this roll-up. Wow, we've got every chair full. It's fabulous. Look, I'll just go back a bit. There you go, Scott. I'm not going to talk much. We started a little bit late because of the traffic and it's difficult to find, etc. But we've got enough time. We've padded it around, so we'll be able to absorb it all. So you will be done up here by midday, and then you'll have a little bit more time to wander the stalls. So firstly, welcome. Thank you to Jim for that. You will notice that we're a slight bit late for World Autism Day, roughly a month and a couple of days. I apologise for that. I take full responsibility. The diaries were a little bit unrelenting this year, so that was the reason, but we're here. I'm not going to talk anymore, rather than just to say that we've got just an amazing array of speakers today. I always like to start by thanking people, because it's ludicrous to thank people at the end, because then it's an afterthought. But without these people, we really wouldn't be here today. Firstly, to Ascot and George Vlahos, who have just been terrific in this whole thing, so thank you very much. To the service providers, a couple of us have been very fortunate enough to travel around Australia in the last couple of weeks to each of the major cities and seen what's on the ground in the different cities. And I can tell you that we absolutely kick their ass. We are just doing fabulous. So thank you so much, excuse my language, but thank you so much to those service providers for here. We're all very, very lucky for people, for them to be here, as well as to have their services. So please wander the stalls. It'd be really, really terrific for that. So then the speakers have dedicated their time to come here today. They don't get a cent to do this, and they're here because they really want to share knowledge. So thank you to you guys. To Kyra Evans, who's really been the organisational whiz behind this. Thank you, Kyra, and I'll thank you again at the end. But last and certainly not least, and probably foremost, is the Rotary Club of Scarborough. It was such a fortuitous meeting for me to have a chat to the Rotary Club of Scarborough, in particular Jim Joseph. Rotary have done more than almost any of us to support autism in the community in Perth, and particularly the Rotary Club of Scarborough. Not only is all of this due to them, and this is number 4, which is terrific. I can't believe we're up to number 4. But also with regards to the support of the WA Autism Register, which is absolutely critical. I didn't start it. I loved the fact that I could have, but I didn't. But it's a wonderful resource that is internationally known and has driven so much the international advances in autism. And thank you to the Rotary Club of Scarborough for today in support of that. So before we get going, I just wanted to say that, and now we will. So the first speaker today, probably the most important thing, I think, for all of us is to hear actually the voice of people on the spectrum themselves. It's just ludicrous for us to have any kind of event without actually hearing from people on the spectrum, and we're so lucky today to have Scott Sadler. Scott is going to give us some personal reflections on autism. He's a terrific bloke. He's got just a really terrific story that he's going to share to us. He's IT savvy, and I got this from the internet, Scott. I hope you don't mind. You love snooker, reading, movies, and the Eagles. That's about right? No, fabulous. Not in that order. I hope it's Eagles number 1. Thank you. Okay. He's also a graduate of Autism West's public speaking course, and certainly not favouring anyone, but do check that out, because it's a wonderful gap that's been it's a gap that's been in the service provider land for quite a long time, and it's a terrific course. So without further ado, Scott's going to read a little bit of personal reflections about his life. So thanks, Scott.
Thank you, Andrew, for the introduction. My name is Scott, and I have autism and associated disorders. I would like to speak to you today about my experiences. I was diagnosed with Tourette's syndrome, and then later Asperger's syndrome and a developmental disorder while attending primary school. My mother tried in vain for many years to obtain assistance from the limited services that were available at that time. I had no support or help from anyone other than my mother, found it extremely difficult to make friends, and was labelled strange by some. Many people, as well as my family, found my disability hard or impossible to understand. I was misunderstood by my teachers in primary school just because I completed class work differently, could not sit still for long, follow instructions, or keep up with the lesson. I became agitated and stressed in class and was reprimanded because I was unable to do exactly what the teachers required me to do. I was bullied and teased at school, close to breaking point for both my mother and I. It was not until high school that I was diagnosed with an autism spectrum disorder, and with the help of the principal, some teachers, doctors and specialists, Mum was able to have an individualised education program initiated for me. An education aid was also provided to support my needs, which enabled me to accomplish and enjoy my schooling, resulting in me excelling in most subjects. I had some very unpleasant experiences both in the community and a previous workplace, which left me devastated, disheartened, withdrawn and afraid. I was also a client of a service provider that did not understand my disability, and the activities they chose were not suitable for me to participate in. This left me downhearted and unable to work towards improving myself by learning new skills and ideas. I now enjoy secure and interesting part-time employment in an understanding and supportive environment. I'm currently working at Autism West doing web design, administration work. As part of my work with Autism West, it has allowed me to appear in various local newspapers. I had the opportunity of giving a presentation at the Autism West Symposium in 2015 and appearing on the Channel 7 News. I have attended woodwork, and with the assistance of my support workers and technicians operating machinery, have made a few paper towel holders, a DVD shelf, spice rack, pool cue case and a TV cabinet. I participated in the Autism West public speaking program, and at present am learning coding and robotics at Autism West. I also assist in planning the activities for each term and choosing suitable equipment to purchase. My mother is overjoyed with the results and the interest I show in my accomplishments. For my physical health and well-being, I attend a weekly exercise program and hydrotherapy with a support worker, which helps ease my muscle twitches and keeps me motivated. My hobbies and interests are movies, frisbee disc golf, reading, computer, video games, snooker and the Eagles. I currently live in a rental unit in East Victoria Park, where I receive support services to assist me in my daily living, community living, transport and employment. These supports also make it easier for my mother in her caring role. I have a weekly timetable, Webster packs, which are pre-packaged medication in sections to be taken at certain times each day, a tablet timer, kitchen and bathroom aids, and a monitored personal alarm in my unit for my safety and security. All of these items are to help me with my daily routine. With the encouragement and support of my mother, doctors, psychologists, support workers and service providers, I feel I have come a long way and am now a more positive and happier person. I have made huge progress, but there are still objectives I would like to achieve, such as becoming more independent with my daily living skills. I am slowly becoming more confident in catching public transport, and having my support worker alongside is really helpful. With the confidence I now have and the support I receive, I am now able to enjoy a wider range of activities and feel safe accessing different places with my support workers. I no longer want to stay at home all the time and feel less anxious out in the community. However, there are still things that I am unable to do or may never do like most people, such as managing my anxieties and difficulties I face each day, or riding public transport independently because of my anxiety issues, managing my financial affairs, driving a car or cooking a meal without supervision and assistance. For me to handle cooking utensils, contain hot liquids or foods, sharp objects, operate machinery or drive a vehicle, I would need to have full concentration and steady hands, neither of which I have because of my anxieties, uncontrollable twitches, and muscle spasms. You could just ask my leg right now, it's twitching like crazy. I take several medications daily to help reduce them and can restrain my twitches for a limited period, but at times they manifest suddenly and without warning. It is imperative to understand the traits, triggers and behaviours of autism and associated disorders, especially by support workers, teachers and school psychologists, doctors and other professions involving people with autism. A good support worker, for example, must be compassionate, reliable and helpful, have the capability of having meaningful discussions with me, involve me in decision making and help me to make choices. They must ensure I am relaxed and have fun. They should show interest, establish a good rapport with me, and participate in activities. Finally, they need to look out for my welfare. For example, be aware of any dangers as well as my well-being and be prepared to stand up for my rights. People with an invisible disability such as autism spectrum disorder, their families, carers and guardians find it exhausting fighting for vital supports because of eligibility criteria, lack of understanding, advocacy, support workers, suitable support workers, funding, negative judgments and indifference. It is not easy for me to stand here today and share my life story with you, but I think it is important for people to understand how hard life can be for someone with autism and how hard it can be for their families. My mum has been an incredible influence and support, and I am really glad she is here today. Thank you for listening and giving me the opportunity to share with you some of the challenges people like me have to go through every day. Thank you.
Just fabulous. Thank you, mate. That's so brave of you to get up. I know that public speaking is so difficult. You can see a meal that I make of it every now and then. So, look, that was just terrific. You also look terrific at the moment. I mean, I feel very embarrassed wearing this, so you look great. Thank you again to Scott. Right, so I realise I forgot to run through the program. This is what happens with a lack of preparation. So Scott obviously gave the first talk. What we now have is a couple of talks from clinical experts. So Regina Lido and also Adam Brett. We'll have a break in between those two talks where you can have time to wander the stalls. People have bought food, so eat. I know I will be during the break. I'll mention something after that. At the final talk will be from Luke Hallam and Sam Moyle, who'll be talking about Ocean Heroes. And I hope you don't mind me saying this, fellas. You bring the sex appeal to today, so make sure you perform. Okay, I know you're not going to like that. After that, we're going to have a panel discussion where you'll get a chance in the break to write down a question that you might like to ask any of our speakers, and we'll have a panel discussion. And that is usually so informative, so I'll tell you how to do that. What we do now is, it's just such a privilege to have Regina Lido come and talk. She's going to talk to us today about the management strategies for challenging behaviours at school. And what a topic. I mean, if there's one thing that I get asked about more than anything, it's this. Regina is a well-known psychologist. She spent 13 years at the Princeton Child Development Institute in the States. The last 5 of those, she lived in a group home providing home intervention to adults on the spectrum. Since returning to Perth in 2011, she's forged just a stellar reputation in the area of autism and in particular what she'll be talking about today. So I'm so pleased to introduce Regina Lido.
So I'm actually really excited to come and talk to you about this today as well, because as Andrew said, probably 90% of the referrals that I get right now as a psychologist and behaviour specialist is about problem behaviour. And this comes from parents, it comes from paediatricians, other professionals, and they really want to know how they can address a lot of the problem behaviour that's going on. And I just want to mention quickly that even though this talks about how do we address problem behaviour or prevent it in school-age children, I actually think that the school-age title is really irrelevant. This is about getting started early, even with children younger than school age. It applies to adolescents, and it certainly applies to the adults that I work with at the moment. Okay? So why do we intervene with problem behaviour? Well, we know when I talk about problem behaviour, we're talking about difficult behaviours such as disruptive behaviour, aggression towards others or to themselves, non-compliance. That's the general family, okay? And there's a lot of research that says that problem behaviour has very significant outcomes. So one of those is that if you have significant problem behaviour in children, it's really a poor predictor of developmental outcomes, social outcomes, of course, in terms of restricting access to community participation and family participation, and of course, educational outcomes. So it's really important, of course, that we address it for those reasons for the individual. On top of that, we also know that problem behaviour has very significant effects on family relationships, okay? All the parents that come to me are under a really significant stress in terms of managing problem behaviour and also managing the family environment. There's obviously significant effects on siblings and other family members, and also extended family, okay? We know that when we get referrals for problem behaviour from teachers, that there's obviously significant teacher stress. It limits the ability of teachers to be able to teach effectively, but it also limits the ability of peers in the classroom to learn effectively in those environments, particularly if the problem behaviour is extremely disruptive. So when I go into addressing and looking at a problem, a referral, the first thing that I do is I make an implicit assumption, okay? And that implicit assumption is that this behaviour is a reasonable adaptation for that individual based on their current abilities and the environment that they're in. And that's how I go in. So I look at it and say, you know, why is this individual having to engage in this behaviour? What are the factors that are, you know, are causing this to happen? So it's kind of like a little bit of, I think, a different way of approaching problem behaviour than I've seen other people do, okay? And we know that extraordinary behaviour can develop and maintain under really ordinary conditions, and there's lots of reasons for that. Now, I could probably, when Andrew was talking to me about doing this talk, and he originally said 15 minutes, I thought, 15 minutes? Can't talk about this stuff in 15 minutes. And then I thought I could talk about this all day, really. I mean, we could do a whole day workshop on problem behaviour, and we probably would just be scratching the surface. So I'm just going to talk to you very much about a summary today. So here are some of the risk factors that we know for problem behaviour in children with autism. So the research obviously tells us that if there's an accompanying intellectual disability, and in terms of the severity of that intellectual disability, that's a risk factor, of course. Having lower adaptive behaviours, you know, being able to cope with the environment, social skills, communication skills in particular, that's a predictor as well. Children with sleep problems, and how many individuals with autism have sleeping difficulties? A lot. That's actually a predicting factor as well. And of course, those three factors are not specific to autism themselves, okay? The two that are really specific to autism themselves are communication impairments, of course, and difficulties, and social skill deficits, all right? We know from a lot of research for probably the last 30 years on communication and problem behaviour that the greater the impairments in communication, the greater the likelihood is that the individual will engage in problem behaviour. Okay? So here are some other risk factors for severe problem behaviour, and we're talking about really severe types of aggression, for example, self-injury, and disruptive behaviour that may cause not only damage to environments but damage to individuals. This is really quite interesting. I'm not sure that many people would have expected that low rates of accepting requests from other people, or what most people would call compliance or instruction following, is a predictor for severe problem behaviour, but it actually is. There's a lot of research to indicate that that is the case. So we know that individuals who engage in severe problem behaviour have low rates of following directions. They also engage in lower rates of meaningful activities. So we find that they're actually not accessing the community as much. They don't have a lot of adaptive skills, and they don't engage in a lot of leisure activities in particular. They don't have a lot of skills that enable them to access their environment in adaptive ways. And finally, of course, we know that communication deficits are also very significant. So the traditional approach, which I'm sure most of you, or I'm hoping most of you are familiar with, is, and we talk about a lot, is, well, what do we do to address this? And one of the major ways that we do this is by avoiding the behaviour from happening in the first place, right? That makes a lot of sense. Let's see if we can arrange the environment and prevent that behaviour from happening. So, for example, if you have a child who's really having difficulty with transitions and predicting upcoming events, we put in schedules, we give them warnings, transition times, we may suggest timers, for example, to indicate the end of an activity to help them transition better. And they're all really excellent strategies. So we provide structure and routine. We also use one-to-one support, provide educational assistance, carers in the community to help interrupt and redirect a lot of that problem behaviour. And we use visual supports when necessary. Sometimes it's not possible or not feasible or practical to avoid triggers for problem behaviour. So if you're working with a child, for example, who engages in severe problem behaviour when they hear a telephone ringing, for example, it's very difficult to tell caregivers and people out in the community not to carry a phone. And that's been a particular experience of mine working with an individual. So sometimes we have to think about ways that we have to address the problem behaviour. We can't do things to avoid it. So the second major approach to dealing with problem behaviour, and it's got really hundreds and hundreds of studies to support it, is the idea that problem behaviour is significantly related to communication, okay? That the individual is serving a purpose, that the problem behaviour is serving a purpose, and that is to communicate something that that person requires. And typically there are what we call the four functions of problem behaviour in terms of communication. The first is social attention. Okay, I either need social attention right now for some reason because I would like access to something, or I would like you to go away, or I'd like you to stop doing that, or I'd like you to come and attend to me. Then we know that also people engage in problem behaviour to get the things that they like. Okay, this is the only way someone can come attend to me and change this activity for me. Okay, because I don't have the skills to do it any other way. I'd like this activity to stop. Okay, and that's typically one of the most common reasons that I'm called in, is about problem behaviour that serves to escape demands from people, task demands at school or instructions that people give individuals. Okay. And so functional communication training has this premise that problem behaviour is a function of communication. So what we do is we teach an alternative, equally efficient and effective communicative response to replace the problem behaviour. So for example, if a student's engaging in disruptive behaviour by throwing things off a desk, and the consequences naturally are that the person is attended to and they're told to pick up the materials, and then somewhere along the lines there, something happens that the individual particularly wanted to happen as well occurs. Okay, so what we do is we teach an alternative skill. Put your hand up. If you've got verbal skills, say excuse me. And we try and teach people responding, caregivers who are responding to the individual, to always initially respond to that alternative request, right? Because the alternative request has to be as efficient and effective as the problem behaviour, or you're not going to get that shift, okay? So they're the kind of the traditional approaches to dealing with severe problem behaviour. So recently I've started looking at some ideas about saying, okay, well, what are we doing in early intervention? What are the skills that individuals need to know that may prevent some of this problem behaviour happening in the first place? And I came up with sort of my own list of things. And then I got really excited because I started doing some research, and I found that, lo and behold, there was some research that's done that identifies some of the skills that prevent problem behaviour occurring in the first place, and they were almost identical. I was like, I missed my calling here. So let's have a look at this. So there's a guy called Greg Hanley who's a behaviour analyst and psychologist working in northeast United States. And what he did was he looked at all of the literature on functional assessment of problem behaviour, which is the gold standard for treating problem behaviour at the moment. And he looked at all the hundreds of studies with that and identified what the skills were that were required to, really necessary critical skills for preventing problem behaviour. He then went and looked at the school readiness literature and interviewed over 3,000 childcare experts. So that included, early childhood practitioners, school-age teachers, daycare staff, and he came up with a list and started looking at the idea that in schools, particularly in early schooling, that instead of looking at academic readiness, why don't we look at social skills? What are the social skills that are required to help children with autism and any child become, functioning members of their society? So this is what came up, right? He's called it the Preschool Lives Curriculum. If you actually just Google it, you will find a whole lot of research on it. You'll also see there's a manual for it for teachers who are interested and looking at maybe doing something new in their classrooms, and I really encourage you to do that. And once again, you can see some of these things we've already discussed as being predictors of problem behaviour, okay? Instruction following. So if you asked a teacher, what is the primary thing that you would like your pupil or your student to do in the classroom, they would say, I would really like them to follow directions, right? When I ask them to do something, I would like them to do it in a timely manner. Okay. He also identified functional communication as really critical from child-giving experts and also in the problem behaviour literature. So this means asking for help. How do you ask for something to stop? How do you ask for your basic needs to be met? How do you indicate to people that you don't like something? These were all really critical skills that also teachers thought that students needed as well. And then the third one's really quite interesting, and I'm sure maybe once we talk about it a little bit more it'll make a lot of sense. So what teachers identified and what was identified in literature was the ability of individuals with disabilities and children in general to accept, which is to tolerate, denial of requests or delay of requests. So if the child asks for something, to be told, no, you can't have it right now, or no, you have to wait for that. Who thinks that that might be a fantastic skill to teach a child? Only one person? Okay, right? Because in a lot of situations, what you tend to have is when you delay or deny access to that particular thing that the child wants, you get a lot of problem behaviour. Okay, so this is what tolerance is talking about. And then we're looking at friendship skills. And of course, what we mean by friendship skills are, for older children and those with some, more appropriate language and more significant language skills, accepting, sharing, turn-taking, and reacting to the distress of others. And we know these are all core deficits in children with autism anyway. So let's break those down really quickly. I'm just going to go over them really, really fast. And this is what he taught in his first seminal study with a group of preschool children. First skill he taught them was, how do you respond appropriately to your name? And teaching them things like, when someone calls your name, you need to stop what you're doing, you need to look at them, and you need to answer. Okay, and of course these can be individually, determined based on individual skills and level of ability. But generally it's saying attend, orient to the person who's giving you a direction. I think that's a fantastic thing to do, and I know that so many early intervention providers at the moment already do this, so this is fantastic, okay? And we also are really, really good at teaching simple directions, okay? Start off with one-step directions, work on to two-step directions, follow multiple step directions. And again, lots of therapeutic outcomes, and we know lots of people are already doing this. Then we start teaching functional communication, and this is where things start to shift a little bit, I think. So there's a lot of stuff that's being done, a lot of intervention on teaching children to communicate. But there's also a lot of stuff teaching children to communicate about labelling things and making sentences, and they're all wonderful, and prepositions, they're all wonderful. But we also need to make sure that we're really looking at functional communication skills that get individuals what they need and want. Okay? Help me, please. That's taught pretty well. Okay? Then how to recruit attention appropriately. How do you tap someone on the shoulder or say, excuse me, or raise your hand, rather than bite yourself or push items off a table or hit the person next to you or fall to the floor crying. Okay? And then he started teaching frame requests, which really just means a more complex communication request. So when we start teaching and addressing problem behaviour, we start with something really simple. Raise your hand, say help, say break please, make a sign for break. Okay? And with those simple communication requests, we honour them immediately. Then we start to look at more complex communication. And so what we do with that is we say, we have to start teaching a delay. What if you make a sign for break and no one's seen you because the teacher's busy attending to somebody else? What happens then? So we start to teach children, and this is what he did as well, is to recruit attention, right? First you have to get the person's attention before you ask for the break. Okay, first you have to get the caregiver's attention before you say you need help. Because if you say you need help and they haven't attended to you, then they haven't heard you. Okay? And this happens also with peers. So he looked at, how do you do it with peers? How do you say to your peer, excuse me, or hey Johnny, can I have that toy please? I want a turn. I'd like the swing. My turn. Okay? Once all of that is really well established, he started looking at tolerating delays. So the child asks for something, excuse me, can I please have? And the teacher says, not right now, Johnny. Okay? How about you have it after Mary's had it? Okay? And we, of course, have to really reinforce that. And the same thing, after that's been acquired, we start looking at delays imposed by peers. If the child says, can I have that? And the child says, not right now, I'm playing with it. Right? I think these are skills that all preschoolers need to learn, and this is where the research started. It was in the literature for typically developing preschoolers. Okay? So here are the outcomes of his original study. So 400% increase in social skills. That's pretty impressive, I think, right? And then a 78% decrease in problem behaviour. And the other thing that was really great about that was that teachers and the caregivers who implemented this program had really high satisfaction ratings, because what they were saying was, these are really important adaptive skills that I'd like to see for all of my students in the class, not just students with disabilities. Okay. So then this is the stuff that I talked about. So and that I was teaching, and like I said, I was pretty happy because it's kind of around the same thing. So let's start thinking about really reinforcing and teaching and strengthening adaptive behaviours from a very, very young age. Okay? Teach kids to start asking for help as one of the very first things that they do. Teach kids how to appropriately, try and seek someone's attention in really functional, effective ways from a very early age. Okay? Teach young children to accept someone saying, no, you can't have this. Or you can have it later. Okay? Second one was talking about adapting, the environment. And, yes, we know that routine is really, really good for some individuals with autism, but it's so important for us to also make sure that we teach flexibility in that. You know, are we doing enough things to promote flexibility and flexible behaviour in our students? Usually when I see problem behaviour at the moment, particularly severe problem behaviour, I very, very rarely see good functional communication. Help, I don't know how to do this, stop doing this, go away, I need some time to myself, I don't like that, I need to remove myself. And that's what opting out procedures are, okay? When we do this, what I say to teachers is, let's teach them to opt out when they don't need to opt out, okay? So what we do is we set up a situation where a child is doing an activity that is quite neutral. It's not highly preferred, it's not really disliked, it's just neutral. And then we will teach them communication response to opt out, and they get to opt out, right? We don't want to initially teach that communicative response either for something that's highly preferred, because we're going to get problem behaviour because they're not going to want to leave, or with really difficult behaviour, because usually what's going to happen is we've already started to get an escalation. So we teach the skills separately in neutral situations, neutral conditions, and then we start to prompt them and reinforce them for doing it when things become difficult. And we set up the situations, and that's the difference. We don't wait for the situations to happen, we will set those situations up. So if we're teaching someone to take a break, for example, oh, have I gone up too far? So if we teach, for example, someone to take a break, we will practice with a neutral activity, and then I will say to the teacher, okay, what's their least preferred activity? Let's look at that. I want you to approach them, and I want you to go and say to them, it's time to do your division, or it's time to go to woodwork, or it's time to go to cooking. And then immediately after they've said that, I prompt them to use already their opt-out procedure. Right? And then once we've taught that and that looks really reliable, and you can imagine most of my students love that, because what happens, they get to opt out of lots of things they don't like to do, right? Then we teach tolerance. You know what, today I really, really want you to go to art, okay? And then sometimes when they're halfway to art, we say, guess what, you did such a good job tolerating that, how about we not go to art, let's go do something else, okay? Sometimes we go to art and we sit there for 5 minutes, sometimes we sit there for the whole lesson, sometimes we're just halfway there and then we turn around. So we make the consequences unpredictable, but really what we're saying is we will always try to honour your requests initially, and then we'll try and build around them. But we'll always reinforce your appropriate communication, because that's what's important, okay? Let's learn how to interrupt and redirect early. Let's look for signs. A lot of people will say to me, and teachers, this just comes out of the blue. There's just no triggers. I can't find any reason. There's usually, unless there's a physiological basis, there usually is a trigger. And that trigger may be 10 minutes before, something might have happened an hour before, but typically there's a trigger. And usually with severe problem behaviour, when we're looking at really severe problem behaviour, there are usually warning signs right before it happens as well. So let's try and get in early, before the problem behaviour happens, okay? And again, so I've got these as all threes, but attend to appropriate behaviour. And I know that's hard sometimes if the child's been quiet and they're doing what they're supposed to be doing. The parent says, great, now I can go and do this. Or the teacher says, fantastic, now I can go and do this. But it's so important to attend to good behaviour when it happens, and not just to attend to problem behaviour. Okay. So for older adolescents and children, we want to teach them also about other pro-social skills. We know that social skills are really, really critical. We want to teach adaptive social skills for older adolescents and children. Comfort other people in distress. Offer to share materials. Teach helping behaviours. If we can teach children that if someone drops a pencil, that you pick it up and hand it to them, these are important life skills, increases their social competence. Show good sportsmanship. Let's teach that early. Lots of board games, lots of reinforcement for saying the appropriate things. right? How do you handle teasing? We start teaching some of those things as well. Teach the right skills. Complimenting other people, you know? Knowing how to enter and exit a group. So these are some of the early skills that we're actually starting to teach some of our adolescents to prevent problem behaviour from happening in the first place. So this has been like a super, it's been like a super fast discussion, but I hope it kind of gives you a bit of a flavour for the things that we're talking about. But really what the big emphasis for me is to say, let's start early. Let's not wait till the problem behaviour gets really bad. Let's look at communication. How do we teach kids to wait? How do we teach them early so that we don't have to kind of, sometimes we miss that optimal opportunity to teach those skills if we wait for too long. Thank you.
To continue what I think has been a great morning already, we're extraordinarily privileged to have Dr. Adam Brett here. Adam's a consultant psychiatrist in Perth at the Mental Health Court. He's one of WA's leading psychiatrists really in any area, but particularly in the area of autism. He's done volunteer work abroad in India, and I know he's probably seen huge amounts of kids, of people associated in this room. So he's an all-round lovely fellow. So please welcome Adam Brett.
Thanks very much for inviting me here. It's fantastic. I've had a couple of very great talks to follow. Difficult act. My talk's going to be about navigating the mental health system. I think knowledge is power. Unfortunately, the adult mental health system is difficult to navigate, and I hope it's not too depressing. If it is too depressing, just fantasise about the next speakers who Andrew's talked about. And just with regard to knowledge is power, I'd just like to plug Andrew's, I don't know if they're podcasts or their 60-second education pieces, which you can register with, and they're from Telethon, and they just give 60 seconds of information about autism, and I think they're great. Okay, so just an overview. This is what I'm going to talk about today. It's just my work, mental health issues, questions to ask. So that's questions to ask the people who are involved in people who are looking after your friends, daughters, sons, whoever. And lastly, a clarion call or a call to arms, what we need to do to improve services in WA. So a lot of clinicians often ask me, what is autism? And it's always quite a difficult question to ask. I usually give the rather trite sort of textbook definition, which is it's a lifelong developmental disability that affects how a person communicates with and relates to other people and how they experience the world around them. I stress that it's a huge spectrum of disorders. I give talks to trainees and I always show them videos. I usually show them extremes. I show them a video of Daniel Tammet, who's a guy with a huge brain who recites pi to about 1 million decimal places and learns new languages in a week. And then I show them videos of people who are non-verbal, self-harming, and having great difficulties. So it's a huge spectrum. I did hear a much better definition though, and this is from a website which again you can register with. It's called The Mighty, and it gives you updates on research in autism and information. And this was a definition by someone with high functioning autism. And he says he just uses 3 words whenever he's asked what is autism. And he says it's always very difficult. And the 3 words is, autism is unique. And I think that's a good starting point. He goes on to say that it's very much like a rainbow. It's full of different colours that stand out, and together they make a beautiful spectrum of light. And I think that's a good starting point for my talk, and that is navigating the maze of mental health is difficult, but it's very important that there are many routes and there are diverse solutions, and they need to be individualised. Now, I can confirm this because I'm a doctor, but children actually do become adults. I use this slide because we don't seem to have planned for our children becoming adults. We're having much more people diagnosed with autism, and there's a lot of services for kids, which is fantastic, but they don't seem to be transferring to adults. Likewise, we have a tsunami of diagnoses of ADHD, and yet there are no public services for ADHD in WA. So I think it's very important that if you have a child with autism on the spectrum, it's important you discuss with the people who are looking after them what's going to happen when they turn 18. So if you're getting medication from a paediatrician, who's going to prescribe when your child turns 18? Wrong way. So I'm an adult psychiatrist. So a psychiatrist, for people who don't know, is I've done a general medical degree, and then you specialise in psychiatry, which is another 5 years training. Then I did specialty in forensic psychiatry, which is the relationship between mental health and the law. And then I've always had an interest in autism, but I sort of stumbled into it. Dr. Hugh Cook, who's a sort of die-in of autism in WA and worked at PMH for a long time and at the West Australian Autism Association, he asked me to do a risk assessment on one of his clients. And what that means is he wanted me to say whether this person was at risk to someone else because of some of the behaviours they'd been doing. And I realised that my knowledge of autism was not good enough to be able to do that assessment for him. So I asked him if I could sit in on some of his clinics to learn more about autism. And I've been at the Autism Association ever since, doing clinics and taking over his clients. Now, the work I do at the association is that I assess people who are in their residential houses or in their individual care programs. So I'm limited to the people who are in the Autism Association. I see people who have comorbid mental health problems, or they have behavioural problems which haven't been able to be managed. The most important thing is I'm part of a multidisciplinary team. So that means when I see somebody, I usually see them with their parents, with a carer, their coordinator, sometimes with a speech therapist, an occupational therapist or a psychologist. So it's usually quite a busy room. But that's absolutely fantastic. And it means that we're getting as much information as we can and sharing that information. I think it's very important that it is seen as a team, and I think the parents are very much part of that team. And it's very important that you work with the team to get the best outcomes. So I usually see people when non-pharmacological approaches have failed, and it links well with Regina's talk about those behavioural techniques to help people. Okay, so there's a lot of mental health issues that people with autism can get. The most important thing to say is people with autism usually present atypically, and so they don't present the same way as people who don't have autism with mental health issues. My core work is usually by talking and listening to people who have mental health issues. And obviously, if you're seeing someone who's non-verbal, they're not going to be able to give you that history. So it's very important that you liaise with other people who know them and can give you more information. So obviously, that's a huge stumbling block. Now, anxiety is a very common problem in autism, as is obsessive-compulsive symptoms. And in themselves, they're not necessarily a problem. But I think when they're causing functional problems, that's when we get involved. So if someone's so anxious they can't leave their house, or if they have so many obsessions and compulsive behaviours that they can't actually do anything because they've got to check things so assiduously before they can do things, then that causes a problem, and that's when I start getting involved. So it's all to do with functional deficits. Psychosis, it can be an issue in autism, and the literature is varied. A lot of papers say that psychosis is more common in autism, and some say that it's overdiagnosed in autism. Well, I can say it's very difficult to assess somebody for psychosis in autism. And sometimes the crossover is between a rich fantasy life versus psychosis. And I've looked after clients for a number of years, and I still am not sure whether they're on the psychotic spectrum or whether it's all related to their autism. Again, the main issue is whether the symptoms they're experiencing are causing them distress or whether they're causing them functional problems. And if they are, that's when we need to start treating them. Down the bottom, there's catatonia, which is said to occur in 1 in 7 people with autism. And it's a very odd sort of syndromic thing. It has a number of problems. It can have motor problems, so people can struggle to move, so they can freeze. They can have difficulty transitioning in and out of cars or across thresholds. And so it can have a lot of motor problems, but it also can have a lot of emotional problems. So they can have a lot of mood dysregulation, where they get very hyper-excited, and other times when they get very lowly excited. That's not really a word. They have low levels of energy. And that can get mixed up then with mood dysregulation. And there's a lot of people I see when they look like they got bipolar disorder because they have episodes where they're so high and so hyper and talking a lot and loads of energy, and then other times when they've got no energy and they're slowed down. And again, that could be catatonia or could be bipolar, and it's sometimes very difficult to differentiate the two. Now, Regina talked about behavioural problems, and I was just going to briefly talk about self-harm, because that's a very distressing and difficult behaviour in autism. It's distressing for the client, it's distressing for families and carers when someone's self-harming, and it's very common. About half of people with autism will engage in self-harm at some point in their life. The behaviours can include head banging, hand biting, hair pulling, eye gouging, face slapping and skin picking. And those symptoms can cause everyone a lot of distress. I'm using self-harm as an example because it's not a mental illness, it's just a symptom. But I'm just going to discuss how we sort of address it. So obviously the causes of self-harm can be hugely varied, and you've got to try and work out why someone's self-harming. So a lot of reasons could be that it's a very powerful communicator. Self-harming, you're communicating something. It may be that the person's not being listened to. It may be that something's happening at school, for instance, they're being bullied, or something else is happening in their life. It could be that they're in pain. It could be that they have bad memories and something's precipitated those. And again, the chronology is not always straightforward. So it might have been something which happened a few days ago, but which is coming to the fore because they've been reminded it, because they've seen something on telly. So our role as a team is to come up with a hypothesis for why someone's self-harming and how to manage it. And what we do is a functional analysis, which is really why is this behaviour occurring and what function does it have for the individual. So that gives us a better understanding. Then it's important to exclude physical causes. So every year all of our clients have a physical health screen and a dental screen. So if you're having toothache and you can't communicate that you're having toothache, it wouldn't be uncommon to hit yourself where the tooth is to try and take away the pain. Some people can have sensory issues, and so we can use different sensory techniques to reduce their self-harm. If we put in communication tools, that can help them communicate, and they wouldn't need to self-harm to communicate. And again, one of the most important things is a behaviour support plan, which Regina talked about. And my next slide says that. It's a bit like the real estate adage about good accommodation is location, location, location. For me, the core to any behavioural problems in autism is a good behaviour support plan. I work in mental health. I work at the Autism Association half a day a week. I work in the mental health court 2 days a week. And it's interesting, just as an aside, we used to call them problem behaviour courts, but that was thought to be inappropriate because it's got a negative attitude with the problem. So now we're called solution-focused courts, which is a lot nicer. I also worked down in Bustleton in general mental health, and I worked in general mental health in Perth as well. And we get a lot of referrals for people with autism with associated problems. Most services don't see them because they see autism as the core problem and they don't have expertise in that area. If I get people referred with autism, I'm happy to see them, but I usually ask for their behaviour support plan first. And if they haven't got one, I say, you really need to go away and get them. Try behavioural methods to manage this problem before we start medication. So a basic definition of a behaviour support plan is it addresses challenging behaviours and enhances positive behaviours. It is non-punitive. It's based on the principle that if you can teach someone a more effective and more acceptable behaviour than the challenging one, the challenging behaviour will reduce. Okay, medication. There's lots of really, really good websites on mental health and autism and medication, and there's lots of really, really bad ones. This is a website I would recommend. It's from the University of Birmingham, and it's got some really good handouts that you can give clients and families. They have easy to read ones, and so there's pictures of what the behaviours they're trying to manage and how they're going to work. A lot of people don't like taking medication, and I can understand that, but if behaviours or symptoms are causing such distress and non-pharmacological approaches haven't worked, I think medication is an important place. I see a lot of people I inherit from child services who are on a lot of medication, and my approach is that I try and get people on the least amount of medication that they need. Hopefully that's none, but in most cases the people I see, they do need some medications. So what should you be asking your doctor? First question is why? Why should my son need medication? And then you've got to say, well, what's it targeting? What's the medication for? So get a very clear idea of what it's for. And then you need to ask, how long do they need to be on this medication? And usually the minimum would be about 6 months, if it works. You also need to find out if they start on medications, who's going to prescribe that when they become an adult. And a good example is dexamphetamines. If someone needs stimulants because they have comorbid ADHD, it's very difficult to get that prescribed as an adult, and there's no services available. So it's very important to work out why. So it's important to discuss exactly what the medication is, and most of the medications are trials. So it's we're going to try this medication and see if it works. These are the symptoms we're going to try and address. If the symptoms reduce, fantastic. We hope the medication's done that. If the symptoms don't reduce, then let's stop the medication and try something else. So it'd be very important for you to keep records to say, yes, this medication worked for this reason, or no, this medication didn't work, this medication had a disastrous effect for these reasons, and keep a log on that. And it can be fantastic if clients can come with a record of their medications, what's worked and what hasn't worked. A good example is to know about what side effects to expect. I saw a very straightforward case when I was working in Joondalup Mental Health. It was for a client with autism who they wanted me to go and see because she'd stopped eating. And this was a major concern. She was losing weight and there was theories about why she was doing this. But she'd been started on a new antipsychotic medication, which the carers and the family weren't aware of the side effects of it. And the main side effect of it was that it numbs your mouth and you can't feel your mouth. So it was no surprise to me that she wasn't eating because no one had told her or anyone else about this. So when we stopped the medication, she had the sensation in her mouth that she started eating again, and it was quite straightforward. So work out what the medication is. A lot of the medications we prescribe do have a lot of side effects. And if people can't articulate what the side effects they're experiencing, or you don't know what to ask them, it can be very difficult. So if you know what side effects they may experience, you can ask appropriate questions about that. We're good for time? We do prescribe a lot of different types of medications. We prescribe antidepressant medications. That's usually for depressive disorders, anxiety disorders, and obsessive type disorders. Those medications are usually very well tolerated, and again, you need to be on them sometime for them to have their effect. The main side effect from antidepressants is usually sexual side effects. In some clients that can be helpful, in some clients that can be detrimental. We use a lot of antipsychotic medications. Now this sounds very frightening, but it shouldn't be. Unfortunately, pharmacological companies are interested in profit, and autism doesn't make them a lot of money. So these medications are developed for schizophrenia. There's one antipsychotic medication which is available for use in autism in Australia, which is risperidone. But there are a lot more modern medications with fewer side effects than that, which we find very useful in autism. And there is an evidence base, and in America and in the UK, they are you can prescribe them for autism. But again, it's important that you ask the relevant questions about those. You know, they're not addictive. They don't have significant side effects. They don't make people zombies. If the side effects are worse than the symptoms you're addressing, the medication should be stopped. I'm very conservative with medications, and so if I stop a medication, I stop it slowly, so I reduce the dose slowly over time. And if symptoms reoccur, then you go back to the previous dose. If symptoms don't reoccur, you can go on and stop them. And likewise, if you start a new medication and it's not having any effect, I'd stop it again. The other important thing is some of the medications do come with physical side effects. Some of them come with obesity and metabolic syndrome, so it's essential that everyone gets annual medical checks to ensure that their bloods are all okay, their weights are okay, the heart's fine, and things like that. Okay, now it gets more depressing. This is the best picture I could get. This is a black hole. There are no mental health services for people with autism in WA. Mental health services don't manage people with autism as a rule, even if they do have co-occurring mental health issues. DSC has the funding to manage people with autism, but they don't employ a psychiatrist to manage people with autism and mental health problems, and there's a huge gap in the market between those two. The private system is very expensive and few specialise in autism. And you don't really want to get me started on difficulties of getting an adult diagnosed with autism in WA. But I don't want it to be all doom and gloom, and we've got a lovely surfing talk next. The clarion call is, well, first of all, I think a good behaviour support plan, a good GP, a good structured day can make a remarkable difference to people with autism. And that should be the sort of aim. And so the vast majority of people with autism shouldn't need to go to mental health services. You should avoid hospitals. There are no autism-friendly hospitals in WA. Obviously, sometimes it's unavoidable, but emergency departments are noisy, flashes, very difficult. It can really make people much worse when they go to hospital. I think what we need is we need an inpatient unit, which is autism-friendly. So if somebody does have mental health issues and they need to go to hospital, it would be an autism-friendly hospital with staff who know about autism. Unfortunately, currently they go into the general mental health service who don't usually know about autism, and it causes everyone chaos. I think there needs to be a free diagnostic clinic in WA for adults. Like I say, I work in adults, not kids. It'd be fantastic for kids as well, but I'm focusing on adults. And that needs to be multidisciplinary, so it'd be a one-stop shop. And there also needs to be a free consultation liaison service. So what that means is a free service. If a client with autism is having mental health issues, they can come to a multidisciplinary team which can address their mental health issues under one roof. And that doesn't occur at the moment. We do that for the guys who live in the Autism Association residences, but for no one else. So that would be my wish list. I'm sorry if it's negative. Hopefully it's given you some ammunition, if you like, or some knowledge about how to manage mental health issues. There are a dearth of services. If anyone's got any power in government, please talk to them, write to your local MP and try and get more services, because all the kids who have autism are going to grow up into adults with autism. That transition from childhood to adulthood is a very difficult period for everyone. If you have autism as well, it's even harder. So mental health issues can come out in that adolescent period. So thanks for listening to me, and thanks for a great day.
Yeah, that was so good. Thanks, mate. That was utterly terrific, and I can see some questions that are going to happen in question time. So, look, we're going to end up, the penultimate stuff that we're going to talk about today is just this most wonderful program, and we've got two great blokes to talk about it, and hopefully we're going to have some great pictures as well. So, talking about Ocean Heroes is Luke Hallam and Sam Moyle. So thanks, guys.
Morning, everybody. My name's Sam Moyle. This is Luke Hallam next to me. Thank you very much, Andrew. Thanks, everyone, for having us here today. Basically, Luke and I don't have any degrees in medicine or anything like that. I'm a marine scientist. He's a personal trainer. But we do have a passion for the ocean, and we do enjoy working with kids with autism. We're just going to show a quick video, and then we're going to talk about what we're about, what we've done so far, and where we want to go. So just bear with me for 1 second here.
Ocean Heroes aims to enhance the lives of those living with autism through surfing. And we've got 75 kids coming down to Brighton Beach today, and they're all going to go catch some waves. Sun's out, wind's offshore, waves are small. It's going to be awesome. Phew.
Ocean Heroes is a not-for-profit set up by local West Australian surfers. We're running events where we're holding kids, taking them surfing one-on-one out in the ocean, getting them into a fun and safe environment, which provides them with an opportunity that they wouldn't normally have. The kids are having a great time. The families that come down love to see their loved ones out in the water in such an energetic and safe and loving environment.
So autism is what we call a neurodevelopmental condition, which means that something happens very early on in development to make the brain develop a little bit differently. And so what Ocean Heroes does is gives these kids a wonderful opportunity to interact, to get out there in the ocean, get their hands dirty, and the long-term benefits of this are just immeasurable.
Just then, I've just got out of the water with a young fella who was really stressed out and screaming for his dad and really uncomfortable, and we got him onto a wave, and by the end of that wave he was beaming and his hands were still on the board and he was looking out at the next wave, and you knew there was a really profound sensory and emotional experience that he's just had from the simple fact of catching a wave on a beautiful day.
Over the last 4 or 5 months it's been growing rapidly, and we hope this will continue into the future. We're really excited.
So if you think you could be a volunteer for Ocean Heroes, hit us up on Facebook and let us know if you'd like to be involved.
All right, so I'm just going to give you a bit of a background on how Ocean Heroes started and what we've done so far. So I'm a personal trainer, and my biggest passion is working with kids with disabilities, and in particular autism. And after training, dozens of kids on the spectrum, I found out that absolutely none of them had ever even tried surfing, let alone gone surfing. And I thought, living in Australia, that's a bit of a shame. We have the best surf in the world, we have the best beaches in the world. All these kids are physically able. Why aren't they surfing? So I did a bit of research and I found this group in California called Surfers Healing, and just coincidentally, they were actually going to Manly 3 months after this phone call I had with them, and they invited me down to come check it out. So I flew over to Manly and I went down to the beach, and they had 200 kids, every single one of them with autism, down there going surfing, and it just blew me away that you see these kids who might be really agitated before they go in the water, and then they go out the back and they relax, and then all of a sudden they're catching these waves and their whole outlook on the day just completely changes, and all they want to do after that is just keep going surfing. So I thought to myself, right, I have to bring this to Perth. I want to get all the kids that I know and all these other kids involved in it, and just give them the opportunity at least to try surfing. So I got together with Sam, also another guy called Jason and his wife Shelley, and my girlfriend Steph, and we created a group called Paddle for Autism, and we competed in this race called the Molokai to Oahu Paddleboard World Championships. So it's a race from one island to another in Hawaii. Sounds very nice, but it was probably the hardest thing I've ever done in my life. And we raised $20,000 to bring Surfers Healing out to Perth for a one-day event. And that event went off like crazy. We had 200 kids, and all the parents that came down were like, yep, this is on, we're going to do more of this. So I'm going to pass on to Sam, and he's going to talk a bit more about what we've done so far. So.
Thanks, Luke. So basically we had that event in March last year, and it was a big hit, but as soon as they were here, they were gone. And we thought to ourselves, look, instead of paddling the channel again and going through the race, we'd rather just set the thing up ourselves. So we set that up in March last year and had our first kind of mock event in May. Sorry, along with another guy, Bomber, who can't be with us today. So the three of us co-founded it, and had our first event in May and had 25 kids down, and we just wanted to kind of test the waters and make sure that what we were doing was a good thing, and we were qualified to run these events. And it went off with a hit. Really well received. I can see some faces in the audience here that have come down to our events before. So, after that we decided we'll give winter a break. It was a bit cold, and get our stuff together and register and become a proper not-for-profit and set it all up. And that's when we approached Professor Andrew Whitehouse and Dr. Andrew Hack, and we've got a treasurer on the board, Nando. Without him, he's the brains. So we've got all these great ideas, but he's the one that actually puts it all together. So we set it up, and then we started having events again in September, and since then we've had 6 events. We've just come back from our first regional event down in Denmark. So, that was really promising to know that we can take this on the road and hopefully run this interstate in the future. But from the past probably 6 or 7 events, we've taken over 450 kids surfing in Perth metropolitan region alone. So, yeah. And that comes down to all the support that we have. We've got some amazing sponsors that donate boards and wetsuits and all the volunteers and the time that goes into all these events. So, it's an amazing experience. We as surfers love it just as much as anyone, and it's really good for all the volunteers to get involved, and it's a good way of spreading the autism awareness into that community as well, and for the family members to come down and see their kids out surfing is just another amazing sight to see. But we're all wrapped up for now. We had our last event on the weekend, and now we'll go back to the drawing board and see where we want to go in the future. But Luke will tell you a bit more about that anyway.
So coming up in the next summer, we want to have a series of 6 or 7 events in Perth. And that's something where we want to grow the numbers each time. So in our very first event back in May last year, we only had 25 kids. And at our last event at Trig in April, we had 120 kids, all with autism, come down. This coming summer, we want to be able to host events with 200 kids every time down at the beach, because we have these massive wait lists of parents that are trying to get into Ocean Heroes, because we actually book out within half an hour each time we put it on Facebook. So it's obviously something that the parents want and that the kids really love, so we're going to try and do as much of it as we can. We also really want to take it to more regional places. So obviously Denmark on the weekend was really cool. All the parents were so stoked that we actually went down there to give them something rather than them having to come up to Perth every time for an event. We're also thinking about heading to Geraldton and Broome to try and run events as well. So that's definitely our goal for next year. And then we want to take it interstate in 2018 and take it to other places around Australia who don't have access to surfing. Another really exciting thing we've got in the works is we have a partnership with a group called Urban Surf, and they're the guys who want to build that wave park in Melville. And if you live in Melville, please vote yes. So pretty much what it is, it's a wave pool that creates the same size wave and the same water temperature over and over and over again. There's obviously no sharks in the wave pool, which is really cool, and it's really safe. But the most exciting thing about this is that there's never been research done into the correlation between autism and surfing. And if you come down to one of our events, like all these parents and what Professor Andrew Whitehouse has seen, when you come down and you see these kids come out of the water completely different and so stoked, and we have feedback coming back from parents saying that their kids go to school for that entire week afterwards and just love school and just want to try all these new things because they went out in the ocean and went surfing, and that was a big confidence boost for them. So that's something that we really want to push. And obviously having Urban Surf and their wave pool is a controlled environment and where we can actually do that. Just a quick highlight of mine was one particular big kid that we took out at our event in November. Sorry, Andrew, we're going to stitch you up here, mate. We've had some really challenging kids along the way, but we get them all surfing. But definitely by far the most challenging was we actually took Professor Andrew Whitehouse surfing. And we handed him a wetsuit and he looked at me and he's like, "So how do I get into this?" So we actually had to help Andrew into the wetsuit, and then we took him out there and we got him surfing. He stood up, which actually amazed me. And then he was so proud, we sent him some photos and he sent them off to his mum to show his mum. And so there you go.
So basically, last but not least, just a big thanks to all the volunteers and families and community support and Andrew and everyone, of course, that really backs us. We couldn't do it without it. Everyone knows, this world revolves on, good, kind, in-heart donations and volunteers. So, from the bottom of our hearts, we really thank that. And just probably there's a few questions that I can already answer, which is basically anyone's welcome. As long as they can fit into a wetsuit and a surfboard, we'll have them. So, sorry, not into a surfboard, into a life jacket. So thank you very much, guys. Cheers.
I'm going to start I'm probably going to go start to the medication issue. Adam, sorry, I hope that's okay if I start with you. There was a question which I've left down there with regards to how do you know when it's time? So my child has, I'm paraphrasing of somebody else, my child has problem behaviours. How do I know when it's actually time to consider medication and even have my child go on medication? Does that work? No, sorry. Maybe you can come and answer it from here.
That's an excellent question. I would say that the time to consider medication is when you've had an extremely good behaviour support plan and that's not working. And so if the problems can't be addressed by changing the environment, by looking at other factors, and they're causing functional problems. So the self-harm is getting too serious, or whether the anxiety is so serious that they can't leave the house, that's the time to consider medication.
Okay, we've got the microphone working? Great. Okay, next one's schooling. So Regina, I might go to you on this one. So schooling is a nightmare for us. I'm paraphrasing what was actually written. How do we find a schooling option that suits us?
$1 million question.
Yeah, indeed.
Can you hear me?
Maybe a bit closer.
$1 million question. Look, I think it just... there's no right or wrong answers for this. I really don't think so. I think you need to go to the school, I think you need to ask some hard questions. My experience is that if you don't have the support of the principal, then you should look elsewhere. That's absolutely key. And you really, really want to make sure that they are willing to work together with you. So it's not a situation where you would drop your child off at the school, pick them up at the end of the day. You really want them to agree that this is a partnership and that you're in this sort of journey together. And if you're not getting those sort of responses, and parents have very good gut feelings, I think, and should listen to their gut, then I think you should look elsewhere if you can. The only other sort of advice that I give is to parents, especially because I do autism diagnosis, and I say to parents, don't assume anything. Be proactive, plan ahead, meet regularly, talk regularly. Don't wait for schools to come to you, go to them, and take that proactive approach. Sorry, no clear solutions.
That's terrific. Thank you. The next one's about early intervention and really beyond early intervention. So early intervention is definitely important, no doubt. But what about after early intervention? What should we concentrate on then? Sure, yeah.
After early intervention, look, I tell you, that's a really easy answer for me. Self-help skills, community participation. Having a diagnosis of autism does not preclude you from having appropriate self-help skills, yet when you do measures of self-help skills for children with autism, you find that they're significantly low. And there's no reason for that. And actually, that's the other part of the time that I spend working with families, is teaching them how to teach their children with autism how to do basic functioning, engage in basic tasks of home living, making your own sandwich, packing your own school bag, unpacking your own school bag, showering independently, lots and lots of toileting. Again, there's not always a good reason why children with autism aren't toilet trained at the same time as other children. Some have additional difficulties, most do not. It just seems to be one of the things that parents think is going to be too hard. So my personal opinion is self-help. Teach these people to be as independent as possible and to feel as competent as possible.
Great. Does anyone else want to have a shot? Adam?
I would just also add that I think the most important thing is to find people's strengths and exacerbate them. So having meaningful activity, whether that's work, play, surfing, I think that's awesome. And can I just add one thing about the surfing? I often prescribe exercise because exercise is very good for you. It's very good for you physically, and very good for you emotionally. And there's evidence that regular exercise makes the same differences to your brain as antidepressant medications. So it actually improves mood and reduces anxiety. So I would have a huge plug for the surface.
Yep. Can I build on that, and I'll throw it to Luke. Talk to us about exercise and the importance of exercise, both for children, adults, and then children and adults on the spectrum. I think it'd be a really important point for an expert like you to discuss. Yep.
So obviously everybody knows exercise is good for you. Obviously not everybody wants to exercise. One thing that I've found with the kids that I've had experience with is once they start that routine of becoming active in the gym, or whether it's outside or surfing or wherever, that routine that builds into, as you guys were saying, a support plan, it adds such a difference because it gives these kids an outlet of energy, so they're not sitting at home, doing it in other ways. It also, as the evidence says, can help them with any of their emotional stress that they have. But on top of that as well, which is, in my opinion, the last thing we should be looking at, but it's also, for kids who are overweight, it can help them lose weight, obviously. But in my opinion, for the benefits of these kids who are on the spectrum, the emotional and the mental benefits that they're going to get from exercise are just immeasurable, really, at this point.
Yeah.
And I think that every kid who has autism should be exercising in some way or another, and that's where my biggest passion lies. So,
Can I build on that and say, okay, my child, I'm being somebody else, but my child sits in loves the iPad. How does one make that leap to introducing exercise? And also, what services are out there? And if you could try and not name specific services, that would be terrific. That's going to be tough. But how do parents get support for this? Yeah.
One thing that I've done in the past with kids who love their iPads and iPhones is that what I'll do is we'll have part of the session, say, on the treadmill with the iPad in front of them, and I'll have control and say every minute they could watch the iPad, and then we'll go and do something else in the gym, and we can wean them off them that way. But sometimes it's just, you can't do that. Sometimes you just, in my experience, we've just had to have the iPad involved in some way or another. But we've had other kids who've just gotten away from it. The gym's a really stimulating environment anyway. There's generally TVs in gyms, and obviously lots of lights and stuff. So mainly the kids are pretty interested already, but sometimes you can do that. So.
Sure. So, and come and have a chat with you afterwards for specific advice, if that's okay.
Yes, if I can name myself.
You absolutely can, just not publicly. Thank you. Scott, I'd like to throw to you on that question about physical health a bit, maybe in about 20 seconds or so. So just have a think about that. In the meantime, what we'll do is we'll just have a quick question about schooling. And I'll go back to Regina. Regina, what's your views on alternative augmentative communication devices? So the use of iPads, the use of piece of kit within schools to help kids communicate?
Yes, the answer is yes. Look, I think that, of course, if you're working towards speech as the primary means of communication, that's really important, fantastic. Kids need to have a voice. And whether that is an augmentative device or speech, you just find out what the primary means of communication is. I think we'd have tended to move away from sign, and there's a few reasons for that. I could be wrong, but certainly I haven't seen it as much. And there are advantages and disadvantages, of course, of all of them. But we've done a lot of functional communication training with augmented devices. The problem with that, though, is when you're looking at it in terms of addressing problem behaviour, it is usually way too delayed, certainly not as efficient as engaging in problem behaviour. So we tend to have to start off with something different, whether it's a sign, for example, if you're asking for help, just to raise your hand, as opposed to go through your augmentative device, find it, search through the right spot, press the right button. You've really just missed the boat then. So you always got to remember that communication needs to be effective and it needs to be efficient. It has to actually produce the same outcomes more quickly than problem behaviour. So if augmented devices are fantastic, but probably not in terms of addressing problem behaviour in the beginning if you've already got it.
Okay.
If you're trying to teach a new skill and they don't have problem behaviour, then that's fantastic.
Adam, did you want to add to that at all? No? All good. Scott, did you want to have maybe just a bit of a chat about physical health and how that's important to you in your life?
With my Tourette syndrome, I've got the physical side of it, not the verbal, so I have a lot of twitches. Same for anyone with autism. I guess the word is STIM, they're repetitive actions. Physical well-being, going to the gym, that can really loosen those muscles, loosen any part of their body that they are stimming with, and afterwards even hydrotherapy, whether it be a hydro pool, whether it be a spa or even just a normal pool, just the relaxation afterwards can then relax the muscles after being tensed up, and that's another well-being thing. So
Yeah. Okay, and I think we'll finish off just one for Sam. Sam, can you, would you mind, maybe, and Luke, just talk about how your passion for autism originated and why you like doing the Ocean Heroes so much, if that's all right? Yeah,
not a problem. Well, basically my passion started through Luke. Luke and I are school friends and surfing friends, and then once we'd started this paddle in Hawaii, I kind of got involved, and I've always been involved in not-for-profits and charities throughout my life, I guess. And for me, this was really one that hit close to home because, you know, I have such a great passion for surfing that it's such an easy way to share it, and it's so good to pass on to these kids because it's such a visual thing as well. I mean, you take these kids out into the ocean and you can see it. You can literally see it in their eyes. They're either going to love it or they're going to hate it. And the kids that are going to hate it, you're going to push them into waves regardless, but the kids that love it just make you do it even more. And I mean, we've only been in this for 12 months, but for me, things like this really open my eyes to the autism community, and I think I want to show all my mates and all my friends, you know, this autism community as well, because it's so prevalent, but it's also so silent. You know, for people my age, 20 to 30 years old, if you're not directly touched by it, you know, you don't really hear about it. So I think Ocean Heroes is really good in that sense.
Yeah, fabulous.
That's mine anyway.
I'll be really quick. So my passion first started with, there's actually a mum in the room today. I first got asked to train her daughter. She was homeschooled at the time and she was 8. And she came in and we started this relationship where I managed to get her confidence back up enough and she started to enjoy exercise, and I started to see the benefits from it. And this particular mum pretty much knows all other mums in Perth who have children with autism, and all of a sudden I had a very large clientele. And then this little girl is very much like a little sister to me. I still see her 2 times a week. She's 16, 15 now, turning 16 this year. And yeah, it's just been amazing to watch her grow. And then obviously, like Sam said, I have a massive passion for the ocean, and tying the two together just seemed like a no-brainer to me.
Yeah, fabulous. I've got warm and fuzzies. Thank you, mate. That's wonderful. Look, thank you to our panel. We're going to wrap it up there. I think just that's such a positive note to end on. And we take for granted that we have a good community within the autism sector. And I think days like this help us acknowledge that how lucky we are. So I'd just like to end by firstly thanking you for your time. 3 and a bit hours is not an easy thing for you to give, and we really do appreciate you coming. Thank you to our speakers. I think you'll agree all of them are just wonderful. You were absolutely terrific, and they may or may not be able to stay around to come and take some individual questions if you can, but if they do have to run off, thank you very much. Just to Ascot again, thank you Ascot for hosting us. It's really the only place that we can get within our price range that has such a large room. So thank you to Ascot and George Vlahos in particular. The service providers, they're going to be hanging around for another half an hour, so please do go and take a look at what they have to offer. Kaya for organising, who's really been the organisational whiz, so thank you Kaya. And then really foremost, I think the Rotary Club of Scarborough. Can we just give them a round of applause, because literally nothing would happen without them. So if you're in Scarborough and you see the clock tower, if you see that clock tower in Scarborough, that's their symbol, because they did that. So thank you to Jim and everyone associated with Rotary Club of Scarborough for everything and putting this on. So thank you guys. That's number 4 down. We looked forward to seeing you back for number 5. But go well and drive safely. Thank you.